One News.
As we've been talking about this morning, Baby Watch is officially over. Greg Dutra, our esteemed meteorologist here on the Morning News. Welcome to Baby Girl, 6:41 this morning. This is his tweet. This is all we really know at this point. Brooke Rose Dutra is the name. Isn't that pretty? I think that's a beautiful name. And now the Baby Watch is done. Time to get Dutra Dad ready. So he can't be here today, but we are continuing Greg's boot camp this morning. If he's not watching, we'll record this segment so he can watch it later. And so we're talking about pacifiers. Are they good? Are they bad? Do you get the cheap ones, the expensive ones? So many questions. The answers seem to change every year. And so we've got a pediatric specialist, Dr. Kristen Woodward, here to talk about that. How are you?
I'm great. How are you?
Good. It's good to see you.
Good to see you, too.
You and I are removed from the pacifier world, thankfully, but it changes. It seems like every year the guidelines kind of change. And you were just telling me a second ago during the commercial that the guidelines in terms of pacifiers actually have changed in the past couple of years.
Absolutely. So in 2017, we revised the guidelines for sudden infant death syndrome. And one of those guidelines, SIDS, and one of those guidelines was the recommendation that babies should be using pacifiers because it does decrease the risk of SIDS.
Wow.
You don't want to force your baby to use one, but parents sometimes, I think, worry, oh, should they not be using one? It's not a bad thing. This is a completely natural reflex.
Right.
Some babies in utero are sucking their fingers or their thumb. It's soothing.
We've all seen that ultrasound.
It helps them fall asleep easier. So you don't need to be shy of using a pacifier.
Well, in this one, the Soothie, I'm sure you've seen this. If you have a child, you probably remember this is likely the one that they gave you in the hospital or they gave your baby in the hospital. I know for us, this is always the default pacifier they gave us. Does that mean we should use this one? Is there a good one or a bad one? I mean, how do we decide which one's the right one?
So what we recommend is that at about 3 to 4 weeks, you offer your baby a pacifier at nap time and at bedtime. You want to make sure that breastfeeding is going well because we get a little bit concerned that if they're used to the pacifier, will they be able to breastfeed? So wait until about 3 to 4 weeks and then start to offer a pacifier. You know, what you want to do is grab a couple and try them.
Yeah.
We don't care which one you use, but we do have some recommendations. They should be one-piece pacifiers, not the two-piece, because those can come apart.
Okay.
They should be 1.5 inches in length so that it can't fit into the baby's mouth. Now, most of them
you mean
are.
You mean width? Like
yes,
this?
And you can't go wrong if you follow the age on the package.
Got it.
So they're usually separated by 0 to 3 months, 6 to 12 months.
So this is the youngest of this is the 0 to 3 months.
Right.
And that's going to be the size of it, right?
Absolutely. And so we don't care which one you use. You just want to make sure your baby likes it.
Well, and these Soothies too. There's one company that sells them with the little stuffed animals attached to them.
Right.
Is that a good thing or a bad thing?
We don't want strings or anything attached to the pacifier. It should just be the pacifier. You want the recommendations on the package, and we kind of recommend this as well. When you first take the pacifier out of the package, put it in boiling water for about 5 minutes, cool it off, and then offer it to your baby. You want to wash them with warm soap and water frequently. I don't want parents stressing out, how often do I need to wash it? You know, frequently is what we say. And then we all know that there comes a time when we need to recommend not using a pacifier.
Yeah.
And that's the tough part, right? And so pacifiers are easy to break than thumb sucking. Thumb sucking is very hard to break.
Yeah.
But at about 1.5 to 2 years old, you want to only offer it when they're falling asleep. And then most kids wean themselves off, but if you're having any trouble, talk to your pediatric dentist or your pediatrician, and you can get some other guidelines.
That's fun.
If they use it longer, it starts to alter the shape of the mouth and the teeth, and so it can actually alter the palate. And so that's why we want them to stop using it.
So that is an issue after 2 if they keep using a pacifier.
And so if you start to notice any changes in your child's mouth or in their teeth, absolutely talk to your pediatrician.
Well, we got to run. Great advice. Always good information. Hopefully Greg and other new parents or parents-to-be are watching. Thank you. This is Greg's baby. Did you see the baby picture yet?
Congratulations, Greg.
Until he sends us a picture, we're just